My name is Colin Jones. I work for North Wales Police. My current role is Health and Safety Manager. I've been in this role for approximately 4.5 years. I returned to the force in November 2019, having first joined as a young cadet on the 27th of September 1971. I remember the day very, very clearly, and then becoming a police officer for approximately 32 years, the majority of which involved roads policing and firearms duties as an armed officer. So looking back, I've had a fantastic career. I've been fortunate, and I'm back now doing a job that I am very fond of. A typical day for me will always inevitably start to check what's been happening during the last 24, 48 hours in terms of injury and near-miss reports, and scrutinising those reports to address any emerging issues, any emerging trends. And also, if there's a need, I liaise with the HSC executive in terms of reporting some serious incidents, injuries, as and when they occur. We do have a healthy health and safety culture in this force. Health and safety is taken very, very seriously. And I'm proud to say that I work with some very enthusiastic managers, line managers, and senior officers to make sure that that is maintained. Near-miss reporting is very significant in terms of policing, because if we can identify hazards or potential risks at an early stage, for example, before they result in an injury, then we have the opportunity to do something about that particular risk or hazard. Health and safety also revolves around, obviously, the well-being, welfare of colleagues and the people who live in our communities. That's really important that we understand the needs of our communities in terms of today's modern-day policing in particular. And we work closely with the Welsh Ambulance Trust and also Save a Life Cymru in terms of providing defibrillators in key stations and buildings that North Wales Police manage and operate, and that they are readily accessible externally for members of the public in the event of a medical emergency. We have detained persons in custody, and they need to be managed and respected, of course, in line with our policies and guidance. And I attend the health and safety custody managers meetings on a regular basis, and we review and discuss various incidents with a view of improving and really trying to lessen any risk to the detained person. And also, of course, our colleagues who work in custody 24/7. It's an interesting challenge, and custody does present its own challenges, unique challenges in some regards. And we work together with other key partners to make that environment as safe as possible. And I'm pleased to say, from a health and safety perspective, we're in a good place in terms of the safety of our detained persons and also our colleagues.